Okay, Helen, you can take it away when you're ready.
Great. Thanks, Katie. Welcome, new committee members. We are so glad you could join us for this orientation tonight. We're happy to have you. My name is Helen Belanca. I'm the chair of the Universal Health Plan Governance Board. And on behalf of the whole board, I want to welcome you to the committees and to the work of the board. We are really happy to have you. We were so pleased to see so much interest in our work and so many great people applying to be on these committees. And we're really appreciative that you're willing to give your time, your energy, your expertise to this work. We really are looking forward to your involvement. So thank you for that. This meeting today is not an official committee meeting. It's just a little bit of an orientation. So in light of that, we're not going to go around and do full introductions of everyone here. We're going to have you save your introductions of yourself and meeting your fellow committee members to your first committee meeting. So stay tuned for that. This presentation that we're going to be doing today is a very high-level overview of the work of the Universal Plan Governance Board. We just wanted to give everybody a common starting place as you dive into the work so that you know what has been done so far and where we are and what we're asking you to help us work on for the future. So it's a lot of detail. It's a couple of dense presentations, and it's normal and expected that you're going to have a lot of questions. For right now, we're going to ask you to hold your questions. We won't be able to get to them. The chat is not on in this meeting, and we likely won't have time at the end to take questions. But if you write your questions down, we are really happy to respond to those either through our info email, which is on the screen now, or you can bring your questions to your committee. So we're just going to try and give you sort of a broad overview. Warren George is going to speak first. He's the vice chair of the board, and he's going to give you some background on the Universal Health Plan Task Force that met a few years ago and was charged with kind of coming up with a blueprint for if we were to do single payer in Oregon, what would it look like? What are the basic outlines of how it would work and what the benefits would be? And they put together a fantastic report. Warren George served on that task force, so he's going to be giving you an overview of that. That work was a really important foundation for our current Universal Health Plan Governance Board. Our job is to sort of pick up the baton, so to speak, from the work that the task force did and dive deeper into the unsolved problems that need to be overcome if we are going to implement this plan. So after Warren speaks, I'll be giving you a little bit of a background on the board itself, and our work so far to date, including establishing these committees. After that, Morgan Cowling's our executive director, and she's going to be reviewing both the work plan of the board, which so you can see how your committee fits into the bigger work plan of the board. And then she's going to be talking a little bit about public meetings laws and public meeting records. So that's very important for you to know about as members of this committee. So we'll save that for the end. If you do have questions about the public meetings work, we probably will have a few minutes at the end to take those. But if you have anything, like I said, specific to the work plan or the committees that you're on, please write them down, hold on to them, and we will get to them. What else? Oh, all of our meetings are public, speaking of which, and so we expect that there are some members of the public listening into this meeting now, so just to be aware of that. And with that, I will turn it over to Warren.
Thank you, Helen. I wish to extend my own congratulations on all of your selection to one of the Governance Board 4 committees. And if there are people here who weren't selected, I congratulate you for applying and your interest, and I hope you stay involved. You can play an important role. As a member of the Joint Task Force on Universal Healthcare, I wrote the task force resolution recommending the formation of the Universal Health Plan Governance Board to complete, for the most part, the financial, revenue, and operations details, which were not completed by the task force. Part of your work will be to learn about the task force findings and recommendations, and from there, you will add your own contributions and innovations. Your work will be challenging, some 55 efforts and studies, have been made toward enactment of a full universal care plan, but no effort has proceeded to implementation. You will need to surpass all previous efforts in your attention to detail, understanding how to design a universal health care plan, which will match Oregon's frustration with the current system, with our ability and willingness to create and support a new plan. Next slide, please. The purpose of the task force was to design a publicly financed single-payer universal healthcare system, which addresses the problems of high cost of healthcare, about double in the United States, the complexity and stress of the current system, and the problems of inequity. Too many Oregonians, because of their race, age, income, geography, or insurance, endure vastly different healthcare access, varied healthcare quality, and wide-ranging health outcomes. Next slide. The task force was one of the larger efforts ever conducted, with 20 task force members, a few staff, numbers of consultants. There were over 100 total meetings of the task force and its committees, including 18 special public engagement meetings for regional underserved populations, healthcare providers, businesses, small and large, and unions. We did offer a meeting for insurance companies, but no one came to our special meeting for them, though they did send a letter. The task force made significant progress in recommending benefits, eligibility, and strategy for provider reimbursement. With our consultant, we showed that a single-payer universal care system could save 10% or more of the cost of healthcare. And as a task force, we recommended dedicating most of that savings to improve regional, primary, and behavioral health services. The significant task, which was not completed, was agreeing on a public funding revenue design for actual implementation. Next slide. Pending a mechanism for funding, the task force recommended a list of key elements for a universal health plan. Helen will talk more about those later, as those recommendations have been passed on to the governance board. Next slide. Using the plan as designed by the task force actuarial consultant estimated that even with the additional services recommended by the task force, a single-payer universal care plan could save about $1 billion in its first year, with the opportunity for savings to increase in subsequent years. Next slide. The consultant estimated that 8 to 10% of the cost of healthcare could be eliminated by simplifying the administrative billing process for medical service providers. Lesser savings were estimated for removal of insurance commissions and marketing, economies of scale, insurance company margins, increased purchasing power for drugs and other supplies, savings making it easier to detect fraud, waste, and abuse. Important to point out that the task force intentionally planned for no savings from reducing the net income of providers for delivering direct patient care. The task force wanted provider income, at least in the aggregate, to come out even with what it is now. Next slide. The consultant also estimated the increased demand for care, which would result when there are fewer financial obstacles to seeking care. Reading from bottom up, estimates are shown for the increase in utilization from elimination of cost sharing, such as copays and deductibles, increased access to Medicare and Medicaid, improving benefits for everyone to be at the PEB level of coverage, which we'll talk more about later, addition of a dental plan covering those who are currently uninsured. The task force voted to go beyond those increased services by setting aside 4 to 8 additional % of the total cost in order to improve services for behavioral, regional, and primary care. Next slide. Total gross savings are projected to be in the range of 11 to 15%, of which the task force recommended to spend about 9% on increased services. This leaves a net savings of somewhere between 1 and 5%, depending on whether the final plan concentrates on lowering the cost or increasing the services. Next slide. Getting into 4 major obstacles for a single payer system. Single payer universal care system is not likely to provide significant savings unless all current provider payments are channeled into a single payer system. Even if just some of the current multi-payer insurance payment system is still allowed, savings could disappear and the total cost may even go up instead of down. To get everyone into a single system, the state already has the legal power to control private medical insurance, but the Federal Employee Retirement Income Security Act of 1974, or ERISA, limits state ability to control self-insured plans typically offered by larger employers. Since states have limited ability to regulate self-insured plans, a workaround as proposed by the task force is to design the financing structure in such a manner that it would make it unlikely that any employer would want to continue their own plans when their employees are already covered by the universal care plan anyway. Next slide. Another obstacle for a state-based universal care system is that it would need special approval in the form of federal waivers in order to blend Medicare, Medicaid, other federal dollars into a state single-payer system. Some possibilities for specific waivers are already in place. A bill currently introduced into Congress would provide a super waiver, making it easier for states to obtain the necessary federal permissions for a state-based universal care system. Next slide. Another major obstacle is the need to design a public revenue system that A, provides enough money to pay for the desired benefit package, and B, which the public will be willing to pay for and support. The task force considered a specific payroll and personal income tax funding combination with a graduated payroll tax of 7 to 10%, graduated personal income tax of 0 to 8%. After a significant study and public input, the task force did not recommend or approve any specific tax strategy. Designing public funding systems is not easy, even when the result can save taxpayers money. Additional work will need to be done by the governance board committees. Next slide. A fourth significant obstacle to enacting and implementing a publicly funded universal care system is overcoming anxiety about large changes. The concluding paragraph of the task force summary report notes that given the enormity of the proposed change, governance board needs to consider designing a transition plan that builds confidence and reduces public risk as it goes along. Thank you. And I will now hand the discussion back to Helen.
Thanks, Warren. So as Warren explained, the task force did tremendous work to kind of create this blueprint for, if Oregon wanted to build a single payer plan, what would it look like? How would all the money go into one place? What is the place it would go to? How would the money go out to providers? And what kind of benefits would people be entitled to? So they did a lot of the groundwork and made a fantastic series of recommendations, one of which was you need a next step. You need a transition board to figure out some of these stickier questions that Warren outlined about Medicare, Medicaid waivers and the ERISA laws about large businesses, and to actually figure out the nuts and bolts of how it would work. And so that was the impetus for creating this board. that said, it's pretty impressive to me that if we tried to cover every Oregon resident, which right now we're not covering about 200,000 people in Oregon, they have no health insurance. So if we cover everybody who lives here, including 200,000 new people, and increase the level of benefits that everyone's entitled to, we could still save money. There are potentials for a significant change in how healthcare is paid for that would result in pretty significant savings to our state. So it's a very compelling argument, a compelling idea. It's just that there's a couple of very difficult problems that we need to sort through in order to figure out a clear implementation plan. That's the work of the committees. So the task force and many advocates, with their help and with help of our legislative leaders, passed Senate Bill 1089 back in 2023, which created the Universal Health Plan Governance Board. So what the bill did was establish the board and state that 9 members would be appointed by the governor, and that 5 of those members would be healthcare representatives and 4 would be public engagement representatives. Senate Bill 1089 asked the board to come up with these deliverables by September of 2026, just 2 short years from now: a comprehensive plan to finance and administer a universal health plan that's responsive to the needs and expectations of the residents of Oregon, to consider certain values and principles, which they outlined and are on the next slide, and to include a plan to create a universal health plan trust fund in the state treasury and a public corporation to administer it. So I want to highlight that for a moment. This is not universal healthcare that would be state-run, government-run. This would be a public corporation that would be created that would operate the plan. The money would live in the state treasury in a trust fund, but the governing body, there would be an iteration of this board, a governance board, that would oversee it, and it would be run by a public corporation. Next slide. The values that are listed in the legislation are a little bit detailed. I'm not going to read all of them, but the first one I think is the most important one, and one reason why all of us are here, I believe, which is that healthcare as a fundamental element of a just society must be secured for all individuals on an equitable basis by public means, similar to public education, public safety, and public infrastructure. That healthcare should be one of those things that you are entitled to just for living here, and that we've got to figure out a way to make that happen so that everybody can get the care that they need. Of course, other values include limiting barriers that are caused by race, ethnicity, disability, region, pregnancy, any other condition that might limit your access. We want to eliminate those barriers to care. The components have to be fully transparent and accountable to the public at every step of the way, and that the funding would be a public trust with any savings that the plan realizes. Those savings need to be reinvested and returned to the public trust and can't be used for profit. Next slide. Oh, you're there already. The principles include the fact that any provider who's licensed in Oregon can be part of the plan. There's no discrimination against any licensed providers, and that participants have a right to join in the decision-making of their care and determine what's medically necessary, and that it's a plan from birth to death based on evidence-informed decisions, and accountable to that. Next slide. So this is our board. These are the 9 members that have been appointed by the governor. We were all appointed in February. Warren and I, you've met. Chun-Wei Chi is a professor at PSU. Debbie Diaz is a physician assistant at OHSU. Amy Fellows, Michelle Glass, Bruce Goldberg, of course, has a long history with health reform in our state. Cheryl Ramirez and Judy Richardson. Cheryl comes from a background in behavioral health. Amy Fellows is a disability advocate. We have a good statewide representation. These 9 members are very committed to this work, and a great team. We also have a very small paid staff. We're all volunteers. All board members are part-time volunteers. And then the 3 paid staff include Morgan Cowling, our executive director, who we will meet shortly, Jenny Donovan, our policy advisor, and then Katie DeLuca, who I know you have all encountered, as she is in charge of running everything and making everything run smoothly. Next slide. So our progress to date, as I said, we were appointed in February. We convened our first meeting in April. And in the past few months, we've been doing a lot of foundational work. We had to establish our general policies and procedures. We've done a lot of education of the board on previous efforts by Oregon Health Authority to increase coverage in our state, as well as some basic education around financing, single payer efforts in other states, and other national models. We worked really hard on our values and principles. Of course, our values and principles were outlined in the legislation. We took those and enhanced them a bit and sort of elaborated on them. That document, after several iterations and full board agreement, that document has been finalized and is posted on our website. So if you want to see the full list of the values and principles that our work is based on, that's on our website. We also developed a work plan and agreed on a preliminary structure that we want the committees to start with. Like, this is how we think it'll look. Any of those elements could change, but this is how we think it'll look as a starting place for the work. And then, as you all know, we elected to create 4 committees, and the board was unanimous in saying we wanted to open those committees to public participation because the 9 of us felt like we weren't sufficient to do this work without more input from folks with expertise, from folks with different lived experience, from folks from different areas of the state. So that's why we created the 4 committees, opened the application process to the public, and get to welcome all of you. Next slide. Okay, so quick review of the preliminary structure. As I mentioned, we put this together. These are elements of the plan that we think we're building, that we put together based on the recommendations that the task force came up with. And they did a ton of background work to come to those recommendations. So we didn't want to redo a lot of that work. So we started with the recommendations that the task force had, and then we deliberated on some of them, adjusted some of them, kind of fine-tuned them a little bit, and said, okay, here's our starting place. This is what we think we're building. But there are so many unanswered questions within those components that we need all of you and the work of the committees to dig into some of the questions, some of which weren't outlined. What do we do about ERISA and large businesses that are self-insured? Can we get waivers? If we can't get waivers, then what do we do? So some of those big questions are what we need to sort through, and the answers to those questions may modify these components of the plan. So this is our starting place, and we will try and get there, but it might need to be modified. So I'll go through them quickly so you can see what we think we're aiming for. So the first element of the preliminary structure is that everyone who lives in Oregon will automatically qualify just based on their residence. We have to clarify some eligibility requirements because there are a lot of folks who work in Oregon but live out of state, especially Washington, and they are depending on their employer for health insurance, and so we need to figure out those eligibility requirements. We've agreed on using PEB benefits as a starting point for the benefit package. So what are all the services that will be covered by the plan? PEB is the Public Employees Benefits Board. It's the health insurance package that public employees receive in Oregon. So the governor, the legislature, anybody who works for the city or the county is eligible for PEB. It's a very nice benefit plan, and we wanted to start with that as our basis. But as Warren alluded to, we definitely need to increase behavioral health support sort of across the board. So PEB is a starting point, and we're hoping to expand the behavioral health benefits. Right now, people who qualify for long-term supports and services through Medicaid and the Department of Human Services will not lose that coverage. We have to be careful that coming onto this plan won't make people ineligible for things that they're currently eligible for. So that's a priority. And then number 4 is my favorite. The plan will not require patients to pay when receiving care. There should be no copays, no deductibles, no coinsurance or premiums. Instead, there will be new revenue sources that will fund the services while protecting families and businesses from financial hardship. That people should be able to get the care they need without having to deliberate about whether they can afford it in that moment, and avoiding care because they can't afford it. Number 5 is we're hoping to eliminate discrepancies in provider payments. So right now, how much a clinician is paid depends on who the insurance company is. And that creates a disparity in the mix of patients they're willing to see. It's hard to get an appointment if you have Medicaid as your insurer, because Medicaid pays less than other insurers and providers have an incentive to take other insurers. So we want to equalize the playing field and have everybody's care paid for the same way to eliminate those disparities. The plan will work with any individual group practice or institutional provider that are licensed and authorized to practice in Oregon in good standing and provide services covered by the plan. So we're not discriminating against anyone. If you're a licensed chiropractor or a naturopath or an acupuncturist, like anybody who's licensed to practice in Oregon can participate. Next slide. The plan will pay providers or provider networks directly. We're trying to eliminate the role of the insurance company, but rates of pay are going to need to account for some regional differences. Health insurance companies, as they currently exist, would essentially go away. They would still have a small role in covering services that are not covered by the plan. So some optional services or enhanced services that complement the plan, but any service they wouldn't be allowed to cover any services that the Universal Health Plan covers. They can't compete with the Universal Health Plan. Workers' comp is a tricky one. We'd have to work on that and figure out what to do about workers' comp. The Universal Health Plan will uncouple health insurance from employment. You would no longer be dependent on your employer to provide health insurance. It would be completely separate from employment. The plan will seek, whenever possible, to address social determinants of health, which we know are really key: housing, food, social status, poverty. All of those things influence people's health, and to the extent possible, we want to address those. Members of our 9 federally recognized tribes in Oregon, including tribal clinicians, will have the option to participate in the plan if they want to. They still are entitled to receive healthcare through the Indian Health Service, but if they want to participate, they'd be more than welcome. And the plan will be overseen by a nonprofit public corporation, not the state, and then the governance board. Next slide. So given that that's our starting point, there are some very difficult dilemmas that we have to sort through. And this slide kind of covers the biggest points that we think of as the work of the committees. Not all the committees will be working on these. You'll notice that some of them are more fit for certain committees than others. I kind of refer to these as the big hairy questions because these are like sort of the big problems that we're trying to sort through that we need to solve before we can issue our report to the legislature. So number one, first and foremost, is a financing plan. How do we pool all the money from healthcare dollars that are currently in our state, from Medicaid, Medicare, commercial plans, the health exchange, the government health exchange, and employers? How do we put all of that in one place? And instead of having people pay out of pocket when they receive care, how do we fairly implement new revenue sources, like possibly a graduated income tax or a payroll tax on businesses, to fund the plan? And then once it's funded, how does it go out to providers? We need to clearly spell out the benefits that we're going to be offering, especially in the behavioral health realm, because that'll be an opportunity for expansion. And then long-term support services and skilled nursing care is a very tricky issue that we need to dig into. We need to clarify the options related to Medicare and Medicaid in terms of whether or not we can get waivers. Those are programs with federal oversight, and so getting waivers is going to be really crucial if we want to do something different than how those programs currently run. We need to create several different financial models for revenue streams that really focus on how do we avoid financial hardship for families and small businesses. Right now, a family who uses Medicaid for their healthcare has no out-of-pocket costs at all. And if we create a new income tax, it's possible that that family will actually have more expenses because now they pay an income tax, whereas before everything was covered without any out-of-pocket. So, and then likewise, many small businesses want to cover their employees, but can't because it's too expensive for them to afford insurance for their employees. We don't want to create a payroll tax that will be imposed on a small business that will then increase their costs instead of decreasing it. We want this financially to work out well for all the different sectors, and that's going to be a tricky puzzle to solve. We need to work with hospitals and clinicians on a plan for a simplified payment strategy for services that accounts for regional differences, but also saves money. How hospitals and clinicians are paid matters quite a bit in terms of how the program operates. And there's a lot of different models out there. We need a simplified system. We need to engage with the healthcare institutions, the businesses, the tribes, and the communities as we're working on this plan. We need to involve them in the discussion, involve them in the problem solving, so that the model that we come up with is acceptable across all of those communities and isn't, we don't inadvertently we don't want to create inadvertent hardships for any of the sectors of our society. And it's going to take a lot of shopping this around into those various sectors to make sure that we are addressing their needs. And then, of course, we need to build a clear transition plan. If we are successful and we can design something that we think will work based on a revenue strategy, a payment strategy, a benefit plan that's going to work, eligibility criteria, if we build all of that, how do we get there from where we are now? We can't just flip a switch and transition. As Warren mentioned, this is $50 billion, and every individual and every business in the state will be affected by this. And so how do you get from what we're doing now to whatever plan we come up with? What does that transition look like? How do you implement it? What are the costs of that? So that'll be a very big nut to crack. Great. So now that I've loaded all of that, I'm going to pass the baton to Morgan so she can talk a little bit about where we are now.
Thanks, Helen. My name is Morgan Cowling, and I'm the Executive Director of the Universal Health Plan Governance Board. Helen did a great overview of those major components and the preliminary structure, and I'm going to walk through how the governance board has organized their work and how they are approaching this and meeting the goals set by the legislation in Senate Bill 1089 for a comprehensive plan to finance and administer the Universal Health Plan. Next slide, please, Katie. So the governance board organized the work into 3 major phases. As Helen outlined, the board has really been in this building the foundation phase right now, updating those values and principles, establishing the work plan, getting up to speed on the issues ahead. And now we are, with the launch of the committees, really looking to start the next phase of that proposal development. The proposal development is going to be the largest phase of this work, where the committees and the board are going to be developing strategies on how to address those big, hairy questions that Helen reviewed. And then looking forward to 2026, we have quite a while, 9 months, to focus on the final report. The board actually built in a little cushion there, thinking that maybe dealing with those big hairy questions might take a little bit longer than the year plus outlined in this. So we have that cushion and available to the committees and to the board. Before that, it says final report to the legislature, but really that's the language we're using around that comprehensive plan. Katie, would you actually go ahead 2 slides and then we'll come back to the next one? Thank you. So digging a little deeper into the phase 2, the board decided to organize the work into 6 major work streams. Work streams 1 and 2 have been combined into the Community Engagement and Communications Committee. The board, I thought that work was pretty aligned. You can see the deliverables in this slide. Really, this is a lot of the outreach that Helen talked about needing to happen with hospitals, health systems, with businesses. And to do that engagement, we're going to need to have communication materials. So they seemed connected together. Workstream 3, finance and revenue, to build that unified financing strategy, and also to do an analysis of the impact on the Universal Health Plan on Oregon's economy. Workstream 4 is where all of that plan design work will happen, where the recommendations to the board will be made on any changes to benefits, eligibility, provider reimbursement, workforce, and cost containment. Those conversations will happen there. And Helen was, as Helen was outlining, the task force and the board have really looked at the preliminary recommendations, but as we delve into these questions, into this work, there may be some recommendations for changes or to take those recommendations even farther. You know, if there will be behavioral health enhancements, what enhancements, what would that benefit plan for additional behavioral health actually look like? So to continue those conversations. Work stream 5 is in the operations. What is the administrative structure for the public corporation? The recommendations on statutory authority, workforce information technology. As part of that plan to the legislature and to the governor, there needs to be enough detail that they could see how to make this actually happen and what's needed to implement the universal health plan. And then the operations committee is also the work stream and the committee that would be tackling those federal waiver issues and looking at those. And then the last work stream 6 is in that transition and implementation. How do you build a transition plan? What is the timeline? How would you go from our current system where there's connection to in healthcare insurance provided by employers? How do you move from the current system into a universal health plan? In these work streams, as I think Warren mentioned, we have 4 committees that the board launched. They align with the work streams 1 through 5. And then the board will be appointing a transition and implementation committee at a future date when the work is farther along. Next slide. So here's a timeline for phases 2 and 3 as we move in out of the foundation building phase and into kind of the proposal development phase. The board has really talked very openly about starting with the finance and revenue work, that this was the work that the joint task force didn't complete, that we need to start there and make sure there's enough time for the committees and the board to really think through how to finance this universal health plan. And then also to lead with community engagement. So many of the deliverables that are included in Senate Bill 1089 are really about engaging the stakeholders that I was just talking about, the businesses, small, large businesses, healthcare providers. And so we wanted to lead with that effort as well. Next slide. So before I move on, one other thing I did want to share there, those slides are a high-level overview of the work plan. The work plan is included with the materials for this orientation, so you can go through. The work plan has a objective for each work stream, some of the tasks and deliverables. Those are then connected to the charters for each of the committees. And in that language, you'll see in the deliverables that there's some language that connects those deliverables to the deliverables in Senate Bill 1089. The board really wanted to use more plain language when outlining the deliverables, but we wanted to still have that connection to the very specific deliverables that the legislature wants to accomplish. So the deliverables in the bill are connected to the deliverables in the work plan. So now I'm going to switch gears.
Morgan, can I jump in for a second?
Sure.
I just want to make a quick comment. So if folks listening on our committees are like the rest of us, after everything you just heard, you might feel like this is pretty daunting. That this is an enormous amount of work that maybe is a little beyond our reach. And I will say that none of us feel fully qualified to do this work. And so if you're feeling that way, congratulations, you're joining the right team. And you know, the staff and the board have agreed that, you know, we need consultants to help us with this. And so we have already contracted with technical assistance from some policy experts who have already joined our team, and they're going to be helping us. Like if we have a question, like what is the benefit structure of Medicaid and how does it compare to PEB, and what's the difference? They could come up with that for us and bring it to the committee. And we're in the process of putting together a request for proposals for a consulting firm to help us with the finance piece. We don't have the expertise to figure out all the pieces of a financial plan. We don't know how to do that. Like, what are the tax options and how would you put this together? And so we will be contracting with an outside firm who have expertise in actuarial analysis and the economic impact. And so we have resources to help the committees with that. We don't expect the folks on the committees to do all of this without help. And so we need your input, we need your advice, we need your help with decision making, but we will have policy and analysis support from some national experts, which we're really excited about.
Thanks, Helen. That's a really good point. And just to add on that, Helen, when she walked through the board, the 9 members of the board talked about the 3 full-time permanent staff for the Universal Health Plan Governance Board. In addition to those staff, we have 2 full-time staff from the Oregon Health Authority that will also help answer some of those questions, especially in regards to the plan design and some of the work we need to do around state agency readiness. And then, as she mentioned, we're bringing in contractors, and those contractors are going to help us with support the board and the committees for the community engagement with we have an interpreter and translation so we can make sure our materials are available in Spanish, the financial contractor and resources, and then also, as she mentioned, some additional technical assistance in health policy. So some of the work that I'm doing and working with the leadership of the board and the other staff is trying to make sure that the committees, when they launch in October, are very well supported with resources. So I'm going to switch gears from the work of the work plan to just talk about some of the nuts and bolts for the committee service. And I'm going to talk a little bit about some transparency and open government laws around public meetings law and public records and requests and retention. The state of Oregon has a policy of openness. It's really important that as appointees to the committees of the Universal Health Plan Governance Board, you will have to follow Oregon's laws around transparency and open government. As Helen talked about earlier, this is also kind of a core value outlined in Senate Bill 1089 of accountability and transparency. In addition, the board and the committees are currently housed at the Department of Business and Consumer Services, which is a state executive branch state agency, and are required to follow public meetings and public records law. These are sometimes referred to as sunshine laws to ensure that the sun and the public can see the work. This transparency is vital to healthy government and democracy. And by serving on these committees, you're a part of the structure. So we want to make sure that you have some increased understanding of those requirements. My goal is to give you a really high-level overview of the most important aspects of those laws as it relates to your service on the committees of the governance board. This is not a comprehensive training on public meetings or public records, and we'll send some additional resources if you, on your own time, want to take a little deeper dive into either of those. Next slide. So, public meetings law. All committees of the board are required to follow public meetings law. As Helen mentioned, this meeting right now, even though there's no discussion, is still a public meeting. So we sent out notice. We'll make this recording available after the meeting and take some high-level minutes so that people can hear what was discussed during this orientation. We also provide information on how the public can attend, and the requirement is that materials need to be sent out with reasonable notice. And the staff for the board works really hard to try and get those out at least a week in advance, but sometimes just because of the the many demands, we try and make sure that at very least materials are sent out 48 hours in advance. That's not only for the public, but for the board and for members of the committee, so you all have enough time to review those materials prior to the meetings. Under public meetings law, members of the public are invited to attend, but that does not necessarily guarantee an opportunity to participate. At the board meetings and committee meetings, there are opportunities for public comment, but like today where there's just presentations, we may have learning sessions, we may have work groups that are just about deliberations. There are some times when there's not public comment guaranteed at the meetings. So back to the slide, a meeting is a convening of any of the committees where there's a quorum. In 2023, the legislature passed House Bill 2805, which created some new definitions for convening. These new definitions include serial communications, and electronic serial communications, and the use of an intermediary. So what that means is that now if you had a committee meeting of, let's say, 8 people, if there was email dialogue back and forth between the committee members over time of a quorum of those committee members, that could be considered an unnoticed public meeting because you had a quorum of the committee, and because you were having discussion about something that would be on a future agenda, that could be considered that public meeting. Also, the use of an intermediary, which is somebody kind of to connect people. So if I talk to Helen, and then I talk to Warren, and then I talk to Chen Wei, and then I talk to 2 other members of the board to try and get consensus on a topic, I would be considered an intermediary. So even though the members of the board didn't have a discussion together, it was over time an intermediary kind of brought the discussion together. So we really have to be aware of those new changes and make sure that the work that's being done and the deliberations that are happening on important topics of the board or the committees are happening in public, in noticed meetings, and together. I will say this last bullet, monthly meetings for each committee have been scheduled, but if over the course of some big hairy topics or some meaty deliberations, you need to schedule additional meetings for those deliberations, staff can help support the committees to do that. We want to make sure that we're having those deliberations in public and the public can listen in on those conversations. Next slide. So in addition to the public meetings law, there's also public records. Under ORS, Oregon Revised Statute 192, every person has a right to inspect any non-exempt record of a public body. The public records law really tries to balance the efficiency of government with the rights of the public to know how government operates. So public records are any documents that are created, electronic, written, a spreadsheet, a Word document that you create in the course of the committee's charge. Any document that you create is a public record. And that means that those public records need to be retained. And you need to keep them so that they're available for the public to request. So any person can request a public record. Just a little bit of the process. Requests would come to the Universal Health Plan Governance Board staff. There are specific timelines and processes outlined in law for responding to those requests. We don't have to create anything new or answer any legal questions. We only have to provide documents that are already in existence and not exempt from public disclosure. So all of that said, here are a couple of tips for complying with public meetings law and public records. We recommend that you not email the full committee, that you not have dialogue between committee members in between public committee meetings. Again, emails back and forth over time between committee members could easily reach that quorum and inadvertently become an unnoticed meeting. If you have questions, you can reach out to the UHPGB.info or email the chair of the committee directly. Emailing the chair or the board liaison to the committees is a way to for us to keep that record, because all of the members of the board have state email addresses. When you email them, if you were going to email them directly for a question, then that would be captured and we would be able to retain that public record in that email. Keep all documents and emails that you edit, create, or modify electronically or in writing. You may want to consider an internal filing system to keep track of the documents that you have all in one place. The questions we keep getting, yes, you can talk with your fellow committee members. This is not to say you cannot communicate with your fellow members, but it's important that you understand that role of the intermediary and not go and talk to one committee member and then another, trying to have a deliberation on an issue that is coming before the committee. And yes, you can email individual members of the committee. But again, you want to make sure that you're not emailing the whole committee and that you're not having that dialogue back and forth. And again, I would recommend that you include the chair or a liaison of the board in any email communications that you have between board members as a way to capture those into the state system where we retain records more automatically. So I will pause there. We have about 7 minutes left. We have a couple minutes for questions. I would ask if your questions are specific to your committee, that you hold those for one of the first committee meetings. If you have a general question about, especially about the public records law, public meetings law, please feel free to ask now. And if we don't get to all of your all of your questions, please be sure to send them to the UHPGB.info email, and we will make sure that those get answered. James, I see your hand up.
Yeah, thank you very much. I'm really excited to be part of this process and learn what's going on. I had a question about the public records piece. So if I were to create, say, a system of keeping my own notes, is that subject to public record if I don't share it with anybody?
Those would be public records. They're documents that you're creating in support of the committee work. So those would be considered public records.
Even if I don't share it?
Yes.
Better be careful.
Craig, I see your hand up.
Hi, thank you. Hi, everyone. Craig Newton here from Medford, Oregon. Hey, this is not about the public records, but it's a very generic question. I'm just curious. I know there's 4 new subcommittees. Can you tell me how many people are on each subcommittee? And that's it. Thank you.
Yes, I know that the board appointed 47 members.
Okay.
I know that those the numbers for each committee differ slightly, so it's not just divided by 4.
Right.
And they are from the largest, which is plan, design, and expenditure, that has 18 committees or 18 members. And then the smallest is the finance and revenue. And I can't remember, 6. people, and I can't remember the other numbers for the
you.
other committees.
I think there's 10 on community engagement and communications. That's 28 and 836, and so 11 then on operations. Math.
Thank
Yeah,
you.
they vary a little bit.
And we will be between now and the first, I think, in October 7th, be putting together web pages for each of the committees that will have the committee membership for each committee, and will be a location for the meeting materials to be posted. So we will try very hard not to clog up your email inboxes, but really refer you to the website where those materials will be posted. And all of the members will be on there on October 7th. Tony, I see your hand up.
Yeah, hey, everybody. Great to meet all of you. Thank you guys so much for the presentation. Just a call out, actually. So the Ethics Committee, the Oregon OGEC, hosts webinars. I may have missed that. My internet was cutting out here this afternoon. But I am signed up for a public meetings tutorial as well, if people wanted to learn more about that in that forum.
Great, thank you. Yes, we'll be sending out some follow-up information, and I hadn't seen that there was just a public meetings law training yet. So if you have that information, we can send that out to the folks so they can get that too.
Yeah, I'll find that. I'll send that to you, Morgan. They're setting up several meetings now.
Wonderful, thank you. Craig.
I just that made me jolt us up my brain. You folks are asking for a short biography on each one of us, and I'm glad it's only 3 to 4 sentences. I wanted to make it real short. I just want to verify that. Is that correct?
That's accurate. We would like to put something on that landing page for each of the committees that has just a very short little paragraph about each of the members. We've been getting questions from the public about who applied, and we thought it would be helpful if you would help us out and write those 3 or 4 sentences, and then we will make them available. That was a great prompt for me to be able to say that. If you haven't sent your 3 to 4 sentences into Katie yet, please do. Wonderful. Well, again, congratulations and thank you to all of you who have volunteered to be a part of this exciting work. We're hard at work right now working with the chairs on those work plans for each of the committees, and the Finance and Revenue Committee will be the first to launch in mid-October, October 15th, and then the community engagement and communications will be next. So we're getting started right out of the bat, and I'm excited that you will all be joining this work.
Thank you all for, again, being on the committee and for coming to the orientation today. We really appreciate it, and we look forward to working with you.
Thank you.
Thanks, everyone. Have a good night.
Thank you. Bye.